In a town hall that you had done not that long back, you mentioned that Medicare Part D was paid for. Now, how was Medicare Part D paid for? I know it's changed in this new healthcare law, and I know that the projection for it is roughly the same money, $750 billion. So if we're looking at the, if you just eliminated that and it's funded for, we paid for this Medicare, or this whole program. If you still have it on top of what we're doing for the medical right now, then you're adding $750 billion to the already $1 trillion deficit in sick. So where did you come up with the Medicare Part D was already paid for?
It was within the budget parameters.
How? Everything we've ever heard is that was always an unfunded mandate.
No. I'll show you that. I'll get your name and
you can actually point me to
yes.
a specific location to go and find out where it shows a zero summing?
Yeah.
Okay.
Yeah, it was all within the budget. The gentleman behind it.
And you mentioned the prescription drug bill that passed 5 or 6 years ago. It's interesting how we've gone 4 years and no one's brought it up, but in the last 2 weeks it seems to have become very popular with some folks. Back then, what we try to do is find the specific efficiencies within Medicare, and we found several that were pretty obvious. For example, in Medicaid area, in many states you could own a home and it was totally exempt. So what people were doing was draining all of their assets, their cash assets, selling their IRA stocks, moving it into a multi-million-dollar home, and then moving to 100% public health care. What we said is no, only a $750,000 exemption could be used. So those are the type of things that help pay for that bill. And remember the difference between what we're talking about now and what that drug plan is. The drug plan is a free enterprise system. It's not mandated on anyone. If you want a prescription drug plan, you can go into the marketplace and buy it. Like the Part B premiums for Medicare, it's a 75-25. The government does subsidize, and I told you how we found the costs in a variety of different ways, so it didn't deficit spend at all. And then the 25% is picked up as a premium paid for by the senior who wanted that coverage. The issue has become the donut hole, because now with the price of prescription drugs, that people our seniors are getting to the donut hole very quickly now. So the issue is, can we cover that? The only reason why there was a donut hole was so there wouldn't be deficit spending with the new prescription drug plan. And keep in mind, there was a full third of our seniors that had no option to have their costs reduced. They paid 100% out of pocket. So for them, it's been a great help. But as I said, the cost of prescriptions have gone up, so now we're looking at ways that we can help close that donut hole.
Congressman?